just lift their head up, so lift your head up. So pretend like you can't, so can you bring your head up as far as you can? We already know it's less than a 3. If they're not able to lift up, there's no point in testing much more than this. It's less than a 3. There's some motion, it's not full range. If we applied overpressure, her head will, hit the ground. So there's some benefit to do it in supine. So okay, we're going to test cervical flexion strength.
Okay, so we're gonna do a 5 first. So you're gonna bring your head up off the table, right, chin to chest. I'm gonna apply pressure, and you're gonna wanna just have your hand behind the patient's head, because if you push and they can't hold resistance, their head's gonna drop to the table.
That's
so you
very
just wanna
important.
protect it. Okay, so you're just gonna push. You're gonna hold it for me. You're not gonna let me push you down. So
Okay.
hold it. Resist me. 1, 2, 3 seconds is usually about good enough for them to hold it. If they are able to hold it without any movement, that would be a 5. Not doing pulses, right?
No.
Okay. So 4, same thing, all the way up. They're able to get through the full range. Okay. You say the same thing. You're gonna hold for me. So 4, there's a little bit of a give. They can hold it. They can take it through the full range of motion, but there's a little bit of give. A 3 is all the way up. Hold for me. So they're able to make it through the full range of motion, but the minute you give them resistance, they drop. So they can make it against gravity, but they cannot hold against resistance. A grade 2 would be a partial range. So if you ask them, bring your chin to your chest for me, and you see that they're struggling to get it up, but there is still movement, that would be a 2. They're not getting to the full range of motion, but they're getting some movement, that's a grade 2. A grade 1 is if you tell them to bring their chin to their chest, and you see no movement. At this point, you have to palpate the muscles that cause cervical flexion. If you palpate, usually it's the SCM, if you palpate and you feel a muscle contraction, that's usually a trace reading or a grade 1. If you ask them to do it and you feel nothing, then that would be a 0.
You can, so also you can ask them to rotate the muscle, and that may trigger the SCM as well. So if you don't get anything in flexion, just see if they can rotate. That may, so that'll still give you a grade 1 if there's some muscle contraction in rotation.
Okay. So extension is prone. This one is.
Let's do
Oh yeah. Oh yeah. Sorry. Forgot. I could have just done rotation too. Okay. This one is extremely important to protect the patient's head. Most people cannot get in this position at this point. Judging that her head is not flat against the back of the table, you could tell she's at least a 3 if she's able to hold it up. Okay, so you're gonna come, bring your head up for me. You're gonna hold it. Arm is at the base of the occiput or occipital region. You're gonna push, hold for me. 1, 2, 3, and that would be a 5. She didn't move. Okay, same thing. Grade 4, I would push again. She would give me a little give. But she's still able to hold some resistance, but there's giving a little. A 3 is if I start to push resistance and her head drops. So this is where you want to have your patient's head protected. So 3, she dropped right down. Okay. A 2, you don't want a patient in this position for a 2, because so position for a 2 would be on the table. This is if you have the patient off the table and you feel them going down, they can't even hold it up against gravity, you'd have them on the table for this one. From here, you'd have them raise, and you would probably get a little bit of partial range there, but you don't want a patient that's a 2 to hang off the table, because they won't be able to get it anyway. So a grade 2, you want it in a gravity minimized position, so where gravity is not affecting the range. Okay, grade 1, same thing, you ask them to do the motion. If you don't see any movement, you palpate the extensors, occipital region, occipitals, cervical extensors. You'd feel a trace contraction, that would be a grade 1. Again, you feel nothing, that's a 0. Okay, and sorry, I have you flipping over like a pancake, I forgot rotation, okay. Okay, so rotation, you can start just by seeing the patient do the motion. So you can be like, okay, can you turn to your left side for me? Okay, perfect. So turn center, right? Do not, I want you to keep your head here. Don't let me move you. So you're gonna push against the patient, and they're gonna be pushing into the rotation that you just checked. If there was no movement, that's a 5. Okay, again, same thing. If she does the rotation and I push against it as a little give, that would be a 4. A 3, push, and I'm able to move her all the way over. So she's not able to handle any of my resistance. A 2, again, you can check if, without resistance, if the patient's able to do it within a partial range or full range. A 2, again, is gravity minimized. They can't handle resistance. You just have them do the motion and see if they can get it into a full range. Usually a 2, they're just not able to get to the full range. Again, trace, the rotation would be the SCM again. There we would see no movement, but you would be able to palpate a muscle contraction. 0, again, would be no muscle contraction. I think that's all.
All right, so pair up, practice, and for you acting out the patient, vary your resistance from a 5 to a 3, just see if you can feel